care in any place where we had a cluster of cases. They will continue to do so. And we'll also continue to conduct weekly COVID surveillance testing in all congregate care settings under the jurisdiction of the Department of Health and Human Services, and the Department of Correction will continue to regularly test staff and inmates in their facilities. We'll continue to discuss other possible measures with our colleagues in the senior and long-term care community to make sure we're doing all we can to keep seniors as safe as possible, as they are among the most vulnerable. With respect to public schools, our Department of Elementary and Secondary Education and our Department of Public Health just released recommendations for public schools for this fall. Again, they're recommendations that are based on the new CDC information and on the state of the pandemic here in Massachusetts. We fully expect cities and towns to make adjustments to do what's right for their specific school districts. But one thing's clear. All schools in all districts must be open every day to every student, no matter what. The documented negative impact on children that resulted from the uneven, unpredictable, and profoundly difficult year that students had last year cannot and must not happen again. In-person learning is the only available option for Massachusetts schools and their students. And hopefully today's guidance will help local officials finish their preparations as they get ready to welcome back their students in the fall. Massachusetts is moving forward in this new normal, and we're moving forward safely. Our job is to continue to make sure everyone has the protections that are made possible by the vaccines. And we'll make sure that everybody has the best possible public health information so that they can make the right decisions about their specific health conditions, and we will continue to double down to protect those who are most at risk here in Massachusetts. And today's guidance is another way we can work together to stay healthy and safe. Thanks. And again, thanks to you at Blue Cross, and thanks to you folks at CIC Health, and thanks to the folks at Madison Park Development Corporation. I like the attitude. Questions?
Governor, how long is this mask guidance going to be in place, and are there specific triggers for when it will get more restrictive? And also, can you say why is this statewide and not in certain areas like the CDC has said, those high infection areas?
So first of all, we think the most important thing people can do to protect themselves and their families is get vaccinated. I can't say that enough. And we're going to be running dozens and dozens and dozens of back-to-school clinics for kids who qualify to get vaccinated between now and significantly into the beginning of the school year. The second thing I would say is part of the reason why we believe we should do statewide guidance. So what if you live in one county, work in another? What if you work in one county, live in another? What if you decide to go to vacation or out to dinner in one county and live in another? And by the way, how is anybody supposed to keep track, given all the stuff that's going on in their daily life, with a rolling 7-day average in which one of 4 elements is going to determine, based on whichever one is highest, whether or not a district is substantially at risk or significantly at risk? Our view on this was the people who have the most to lose here from COVID are the elderly, who were doubling down on many of the initiatives we put in place last fall, which were very successful at keeping them safe, and making clear that if you have a severe condition or the potential to be seriously affected by COVID, you should take extra precautions and wear masks and maintain some degree of distance when you're indoors. And the same goes if you live with, have family members, work with, or have friends who have similar kinds of medical conditions. That guidance, I believe, is a lot simpler and a lot easier and a lot more straightforward and much more appropriate for what we're dealing with at this point in time. And also, if you have any of those medical conditions, you should get vaccinated.
Governor, it sounds like you're sympathetic because we feel like we get mixed messages every week, whether it's federal level, state, local, private, public sector.
The most important message I can deliver, and it shows up in all the data, is you're far less likely to test positive for COVID, to get very sick from COVID, to die of COVID if you get vaccinated. And the folks who are most at risk are people who have underlying medical conditions, and it's right there on the CDC website what they consider those underlying medical conditions to be that put you at risk. And if you're older, and when I say older, I mean 65, 75, etc. And those populations, yes, those folks, they should wear a mask when they're indoors or when they're around other people, especially people they don't know. But it shouldn't matter what county you live in or what town you live in. You should just do that because you are, in many respects, part of the population that has the most to lose here. And that's why we believe if you're not vaccinated, you should get vaccinated, and you should also be careful and wear a mask.
Clarification on that guidance. Just, are you saying, is this saying that if anybody who lives with a child under 12, anybody who has a child under 12 at home, should be wearing a mask inside?
No.
Can you expand on that? Because the way it reads, it says if you live with anyone who's not vaccinated.
Okay, then if that's your interpretation of our guidance. That's not the way it's written. What it's written to mean is that if you are with someone, you live with someone who is vulnerable to COVID, could be, walks around, carries a significant medical condition of their own that would make them vulnerable to COVID, those folks should be careful about that and wear a mask indoors if they believe that's the right thing to do. The other thing they can do is they can always talk to their healthcare provider.
Governor, without the state of emergency, is guidance as far as you're legally able to go? We're not talking about orders anymore.
Yeah.
Could you maybe explain a little bit what you have the power to do right now, and how far could you go without having to do another state of emergency?
I guess what I would say in answer to that question is, talk to the lawyers. There's a lot of debate and discussion about that. I think our view is you have some districts in which 85 or 90, 95%, some cases almost 100% of all the kids between the ages of 12 and 17 are vaccinated. And you have other districts where the numbers are much lower than that. That's part of the reason why we believe we should issue this as guidance with recommendations that are built on this idea that if kids are vaccinated, they don't need to wear a mask if the district decides that they don't need to wear a mask. If they aren't vaccinated, they should wear a mask. And since the kids under the age of 12 aren't eligible yet to be vaccinated, we would recommend that they all wear a mask, as well as unvaccinated staff.
Have you considered another state of emergency at all?
No.
The CDC reported specifically referenced the P-Town outbreak and how bad that was with the Delta variant. Do you fear this is the first step of many to come? Are you worried about the case of Massachusetts?
Well, I guess I'd say two things. One is, let's remember that there are roughly 800 cases that have been, 800 to 1,000 cases that have been identified as part of that cluster. A very, very, very small number actually ended up getting very sick and being hospitalized. That's because most of those folks were vaccinated and vaccines work. That's point number one, which is why everybody in Massachusetts should get vaccinated. The data shows it makes a big difference and it's your best protection. With respect to the second part of the question, there were 10,000 people in Provincetown over that weekend. For those of you who haven't been to Provincetown, it's a small town. 10,000, and it rained all weekend. So I think in some respects you can't draw broad conclusions either here in the Commonwealth or more generally about a particular event like that. We've worked very closely with the CDC to collect data and guidance and information to inform not just their decision making but ours as well, and to make sure the local community has the resources around testing and vaccines that they need to feel comfortable that they're doing all they can as well.
Governor Baker, would FDA authorization make a difference with vaccine hesitancy?
I am one of many governors, Democrats and Republicans, who believe when you get to the point where you've delivered 400 million shots of vaccine and have the kind of results that these vaccines have demonstrated, and you are concerned, as we are, about the Delta variant, where's the urgency at the federal level on this one? Where is it? I mean, I hear from people all the time who say to me, I'd really like to see that thing get final approval. And I don't blame them. I would too. I think it would make a really big difference. And I would love to see the FDA finish their process, put the urgency into it that we all believe it deserves, recognize and understand that 400 million shots later, and a ton of evidence that it makes a positive difference in the lives of those who've chosen to get vaccinated, that it would help. And there's plenty of data there to support it.
Last question.
The federal eviction moratorium expires tomorrow, even though the Biden administration wanted to extend it. I know it already expired here, but what do you think about that? What do you say to those people who are frankly
Yeah.
they're not vulnerable to eviction?
Yeah, we had an eviction moratorium in Massachusetts that expired last October, and we put together a cross-sectional group to work on eviction diversions. And that group has provided tenants and landlords so far with about $280 million worth of rental assistance. And that's both state money and federal money. And we continue to have significant federal resources available, working with our local partners to continue to support people under those circumstances. And in fact, last week, the feds put out the data on how states were doing in terms of actually putting those federal dollars that they were distributed in January to work. And we finished third in the country in the amount of dollars out the door. We think this is an incredibly important piece of our protection program for people. We work very closely with our colleagues in both municipal government and a lot of the folks who work in the housing and affordable housing community to make sure that we're doing what we need to do to support those folks and help them stay in place. We also were one of the first states in the country to put together a program to support folks who are in public housing. And we still have, as I said, significant state and federal resources that are available. And we've actually seen over the course of the year, I think in part because of those resources and the moratorium, a significant decline in the number of notices to quit, which is kind of the first step of a dispute between a landlord and a tenant. Much smaller numbers of folks coming into our emergency assistance program than we would typically see in a given year. But we're going to continue to do everything we can to support folks. And we had a big meeting actually yesterday to talk about the end of the moratorium and to make sure all our folks on the ground were properly prepared to deal with this if it turns out to be an issue that we need to work quickly to solve for folks. But the bottom line is, we did put a pretty significant diversion program in place, and it's worked very well. And I think in some respects, we were ahead of the game among most states because we had a state program. We put the state program together. The state program was working. Once the feds offered us resources in February, we were able to just put them right into the program we'd already developed.
Thanks, everyone.
Governor, the auditor and the state treasurer are requiring vaccines for their employees. Are you still opposed to mandating vaccines for state employees?
Well, like I said, for congregate care sites, which are in many respects the places where our employees and our clients are most at risk, we've been doing weekly surveillance of everybody, residents and staff, and we'll continue to do so. And we'll continue to encourage people, as we have been all along, to get vaccinated.
No requirement.
Not at this time.
Thanks, everyone.
Thank you.
We're going to get them in as well.